This next topic, taking a big turn. This is a really important topic to discuss. The FDA recently made a controversial decision to approve OxyContin for children as young as 11 years of age. And of course, it leads to the question, should fifth graders be able to take this notorious pain medicine? So there's two sides of the story here. So I want to set this up for debate because I don't know that there's a right or wrong answer here, but there's two scenarios. You know, you could have a child at the end of life due to terminal cancer and severe pain. Anything you can do to make them feel better seems to make a lot of sense. But then the alternative is you could have a child who comes out of surgery, you give them OxyContin, and they become lifelong abusers. So where do you guys stand on this?
I think, you know, one thing that whenever we hear about pain management, I swear, I think back to my first day in medical school when we learned about this in pharmacology, and the doctor who lectured us said, here's what doctors need to know about treating pain. The right dose is the dose that works. And I would argue on the side of the people suffering from chronic pain syndromes and not getting adequate treatment because of the fear of turning someone into an addict, because while that is a significant problem, no question, we all learned in medical school that there are pain receptors that are present when you have physical pain. And so when you treat that pain with a prescription medication, it works on those pain receptors.
See, I disagree with you completely, because I think that professor actually did a disservice, which is our professors, when I went to school, and it continued for many years, oversimplified pain management as just treat pain, and no one ever really has taught a lot of doctors how to properly prescribe narcotics. And that's how we got into this mess, because a lot of, you know, I went into practice. I was very fortunate in my training to I think, get very, very good training on how to use these very powerful medicines. And then I went into practice, and I noticed that these were being prescribed like candy.
100%.
And there are a lot of doctors who don't know how to properly prescribe these, and they are the ones who I worry about. I want to treat kids' pain for sure, but I think that if doctors don't know how to properly prescribe these, and you're prescribing OxyContin to someone who doesn't need it...
Well, that's why this is a specialty. Pain management is a specialty.
But anyone can prescribe this.
Pediatric pain management is a specialty in itself. But the good news is, I know in the state of California, to maintain your license, you do have to take CME
I just had to take one in New Jersey. I had to take a whole CME license course in pain management.
Physiology.